In professional discussions about literacy, reading ability and reading confidence are often talked about as if they are the same thing, but they're not. And when we blur the distinction between the two, we risk misinterpreting learners or misunderstanding assessment data and then applying the wrong support. So in this video, I'm going to explore the difference between reading ability and reading confidence and explain how they interact and outline why separating them is essential for accurate assessment and effective intervention. So if this kind of professional discussion is useful, you can like the video or subscribe. Now let's get started. So what do we mean by reading ability? To understand the difference between reading ability and reading confidence, we need to be clear about what reading ability is actually referring to. So reading ability is not a single skill. It's a combination of cognitive and linguistic processes that work together to allow a learner to make sense of written language. At its core, reading ability involves accurate decoding, which is the ability to recognize written words by mapping letters and letter patterns to sounds. This relies heavily on phonological processing, which is the brain's ability to notice, store, and manipulate speech sounds. As reading develops, these decoding processes become more automatic, and automaticity simply means that fewer cognitive resources are needed to recognize words, which frees up space in the working memory for comprehension, which is understanding what the text actually means. Research in cognitive psychology and reading development consistently show that skills reading depends on this balance between accuracy, fluency, and comprehension. When decoding remains effortful, comprehension is often compromised because working memory becomes overloaded. Importantly, reading ability can usually be assessed in relatively objective ways, so through observation, structured reading tasks, and diagnostic assessments. Professionals can identify which components of reading are secure and which require further development. So in other words, reading ability describes what a learner is capable of doing when the task is well structured, the pressure is reduced, and the support is appropriate. So now what do we mean by reading confidence? So reading confidence refers not to a skill level, but to a learner's emotional and psychological relationship with reading. It reflects how safe, competent, and willing the learner feels when faced with reading tasks, particularly in environments where their performance may be visible to others. From a psychological perspective, confidence is shaped by repeated experiences. Learners who experience frequent errors, public correction, or comparison with peers often begin to associate reading with threat rather than curiosity. And over time, this can lead to heightened anxiety, avoidance behaviors, or reduced engagement with text, even when the underlying reading skills are partially or fully present. Research into self-efficacy, which is a person's ability to succeed in specific tasks, shows that confidence strongly influences whether individuals attempt tasks, persist when they encounter difficulty, or recover after mistakes. In literacy contexts, low reading confidence can therefore limit access to reading ability. So a learner may possess the necessary decoding or word recognition skills, but be unable to use them effectively due to anxiety or fear of failure. This is why reading confidence should be understood as a separate but interacting factor. It affects how reading skills are expressed, not whether they exist. So how can reading confidence mask reading ability? One of the most significant challenges for professionals is that low reading confidence can mask genuine reading ability. In practice, this often presents as avoidance or reduced performance rather than obvious skill difficulty. Learners may refuse to read aloud, rush through text, guess at words, or disengage from reading tasks altogether. These behaviors are sometimes interpreted as indicators of low ability, when in fact they are protective responses to anxiety or repeated failure. From a cognitive perspective, anxiety places additional demands on working memory. When working memory is overloaded by stress or fear of making mistakes, fewer cognitive resources are available for decoding and comprehension. As a result, observable performance can deteriorate, even when the underlying skills are particularly secure. This means that when professionals in the classroom or during assessment may not accurately reflect what a learner is capable of doing under low-pressure, supportive conditions. If confidence-related barriers are not recognized, learners may be incorrectly identified as having more significant skill deficits than are actually present, leading to inappropriate intervention choices. The opposite situation can also occur, where reading confidence masks underlying reading difficulty. Some learners appear confident because they are articulate, they have high social skills, or are highly compliant in the classroom setting. They may volunteer to read, participate willingly in discussions, or rely on memorized vocabulary and contextual guessing to maintain the appearance of competence. In these cases, confidence can conceal weaknesses in core reading processes, particularly decoding accuracy, automaticity, or spelling patterns. Research into reading development shows that guessing strategies and visual memorization can temporarily compensate for weak decoding, especially in the early stages of reading. However, as texts become more complex, these strategies become increasingly ineffective. So, when professionals equate visible confidence with secure reading ability, there is a risk that foundational skill gaps go unidentified until academic demands increase significantly. This is why confidence should never be taken as evidence of reading competence on its own. Without careful assessment of underlying skills, learners may be overlooked until difficulties become more pronounced and harder to remediate. For professionals, the distinction between reading ability and reading confidence has significant implication for assessment. If observable performance is taken at face value without considering confidence, assessments risk measuring anxiety, avoidance, or coping strategies rather than underlying reading skills. This is particularly relevant in classroom-based assessments, timed tasks, and situations where reading is performed publicly or under pressure. Research into assessment validity highlights the importance of isolating the skills being measured from extraneous factors such as emotional state, task presentation, or performance anxiety. In literacy assessment, this means ensuring that difficulties in engagement or fluency are not automatically interpreted as deficits in decoding or comprehension. Equally, confident participation should not be assumed to indicate secure underlying skills. Accurate assessment requires professionals to ask two separate but related questions. The first one being, what reading skills does this learner find hard? And the second one is, under what conditions can those skills be reliably assessed? Without addressing both questions, assessment outcomes risk misinforming intervention planning and long-term support decisions. Reading ability and reading confidence do not operate independently. They interact continuously over time. When reading skills are weak and not yet fully developed, learners experience higher rates of errors. Increased errors often lead to corrective feedback, slower progress, and greater visibility of difficulty. Over time, this repeated experience of difficulty can reduce reading confidence, particularly in environments where performance is public or comparison with peers is common. As confidence decreases, learners are more likely to avoid reading tasks, engage less frequently, or rely on compensatory strategies such as guessing or memorization. This reduced engagement limits opportunities for practice, which in turn slows down the development of automaticity and fluency. The result is a self-reinforcing cycle. Skill difficulty reduces confidence, reduced confidence limits access to skill, and limited access slows further skill development. Importantly, this cycle cannot be broken by addressing only one element. Skill-based intervention with attention to confidence may fail to generalize, while confidence-building strategies without targeted skill development are unlikely to lead to sustained progress. So effective literacy support therefore requires a dual focus, developing reading skills while simultaneously creating conditions that allow learners to access those skills safely and consistently. For intervention and classroom practice, separating reading ability from reading confidence is essential. Effective literacy support must address both elements simultaneously. This means explicitly developing missing or insecure reading skills, while also reducing the emotional and cognitive barriers that prevent learners from accessing those skills. From a skills perspective, intervention should be structured, cumulative, and appropriately paced, with careful control of task difficulty to avoid unnecessary overload. From a confidence perspective, learners need predictable routines, reduced public comparison, and opportunities to practice skills in low-risk contexts where errors are treated as part of learning rather than as failure. Importantly, confidence is not built through reassurance alone. It develops through repeated experiences of success on tasks that are challenging but achievable. Classroom practices that separate effort from outcome emphasize progress rather than performance and normalize the need for support help create conditions where learners are willing to engage. When both skill development and emotional safety are addressed, learners are far more likely to generalize progress beyond intervention sessions and into everyday classroom reading. For professionals, a useful way to reframe this distinction is to separate two related but different questions. Reading ability answers the question, what reading skills does this learner have? And reading confidence answers the question, can this learner access those skills reliably in real learning contexts? Both questions are essential, but neither can be answered accurately in isolation. A learner may have the necessary decoding or word recognition skills, but struggle to demonstrate them under pressure. Equally, a learner may appear confident and fluent while relying on compensatory strategies that mask underlying skills gaps. When we hold both questions in mind, assessment becomes more accurate, intervention becomes more targeted, and learners are less likely to be misunderstood. This distinction allows professionals to move beyond surface performance and towards a deeper understanding of each learner's reading profile. Understanding the difference between reading ability and reading confidence allows professionals to make more accurate judgments and more effective support decisions. When we separate underlying skills from emotional access to those skills, we reduce the risk of misinterpreting and creating conditions where learners can genuinely progress. If you're interested in more practical tools and resources that support both skill development and learner confidence, you can find more on my website, the link is down below. And if you'd like more professional level discussions around literacy, dyslexia and learning, you can subscribe to the channel. Thanks for watching, and remember, difference does not mean deficit.